Hi everyone, I'm Dr. Vismaya, Ayurveda surgeon, Changampally Remedium. Today we have with us Dr. Firdouse Chief Physician and Ayurveda Oncology Specialist for the discussion of the topic Integrating Ayurveda Management with Surgical Care in Cancer Management. Welcome ma'am.
Namaskaram.
Madam, there are many oncology cases in which surgery is preferred as a first line of treatment. In your practice, have you suggested surgery as first option in any of the patients?
It depends cases and the condition of patients also. And another thing is the severity of the disease. If it is a small lump, for example, in breast, if it is a small lump in the sense it is lesser than 3 centimeter, it may go by Ayurvedic treatment itself, because most of the cases patients comes to me after they detect a lump in the breast. It may be benign or may not be benign, but we have to decide whether it is cancerous or benign. So I send them for biopsy, and after biopsy if it is very aggressive, then surely I prefer surgery. If it is doubtful and the tumor markers also within normal limits, I try for them. Minimum 2 weeks, maximum for 1 month. That means in 1 month it won't go or it won't grow aggressive. There is a time gap we'll get to treat, because patients never prefer surgery in most of the cases. In any case, even in breast or in any other organs, even in abdomen or even in brain tumor, they never prefer surgery. So we give consideration for their will and their wish, how they want to protect their body. That is the primary responsibility of doctors. But at the same time, we should not due to our neglect, they should not get worsen the conditions. In such cases, I prefer surgery, because even in Ayurveda, our Acharya Sushruta has told surgery should do when it is necessary, and avoid any unnecessary surgeries. You may be no better as an Ayurvedic surgeon.
Yes. Madam, is there any cases where surgery is not at all preferred, or you advise the patient not to go for surgery?
Yes, in many cases, such cases are there, because in malignancy, in malignant cases, it is very tragic. The patient's condition will be very tragic, and they might have, in 4th stage or in last stage, they might have find out they are in cancerous. But in such cases, many organs might have affected. For example, if a patient with unknown primary, they may come to me like I am cancerous, but primary is unknown and multiple organ failure will be there, and they could not, none could save their life. In such cases, why should we send them for surgery? Because it increases their sufferings, even for their family. Because in cancer cases, not like any other disease, it is not a disease for that patient. It is a disease of that family, and even it's a burden for even state. It says the statistics, because in last 2023 in America, Cancer Observatory of American Statistics says that it is 21 million cases of cancers are detected. In that, only 8.9 cases survived for 5 years. In such cases, if it is that all those cases are due to early detection, but in last detection, nothing can do. So why should we make them suffer more? In such cases only, I prefer no surgery. Anyway, we can give some quality of life, and their sufferings can be reduced. If it is sure we could not save their life, I never prefer surgery.
Madam, after the surgery, whether you advise chemo or radiation therapy
Okay.
in specific cases or generally?
In many cases, if the cancer it is in early detection, chemotherapy and radiation surely effective. It affects, sure. In such cases, I prefer chemo and radiation. I usually prefer mild chemo. I talk with other doctors, contemporary doctors, those who are specialists in cancer, chemotherapy and radiation, and we discuss. And after that, if we find it is effective, then I prefer chemo and radiation, otherwise never. Because in many cases in the sense, most of the cases, the literature says that the reason for secondary cancers or metastasis is the first set of chemo or radiation. See, if you think we are healthy people, if a healthy person gets some chemo or radiation, it itself may cause next cancer. That thing will happen in the cancer patients also. Means once the cancer came, it's proliferated, and after that we cut it, and there is nothing can do to prevent next cancer. So we in Ayurveda we give medicines to prevent secondary and metastasis. It is already cut. But if we give means unnecessary chemo, or there is no assurance about the chemo or radiation, but some people think it is contemporary or it is conventional. Conventional method is giving chemo and radiation. That says the literature, or it is conventional method. Only due to that reason I am going for chemo and surgery. That is not preferable. But if there is a sure result, I prefer. Otherwise we'll give only Ayurvedic medicine, and it is very good result we get. And in some other cases, this other treatment can be go with chemotherapy and radiation. But each chemotherapy drug, we should know what type of drug it is. Even it is immunotherapy, precise medicine, everything we have to find. Even in proton therapy, that we have to find which type of medicine they are undergoing, and according to that this medicine will be different. If a patient come to me in chemo, they are in chemo, my medicine will be different for each chemo, because the effect of chemo will be different. There are two things are there. One thing is it should not interact, and that should not cause any interaction of the medicines. And another thing, its good effect should get. The effect of chemotherapy, there is a desired effect that should get, and side effect should not get. That check which medicine and how to give, which dose I should give, and when to give also. That is the criteria.
Okay. Madam, in a patient indicated for surgery, when will you start the Ayurvedic modalities of treatment, such as oral or external?
I mean, if they are indicated for surgery, when I am thinking it is good for the benefit, it is surgery is preferable. In such cases, I used to give some medicines first itself, prior to surgery. Due to that, there are some benefits. One is their hematology condition will be better, and to increase due to increase in immunity and optimize their immunity, the patient could survive well with this surgery. And another thing is, tumor can be shrink with some of our medicines. That is in Ayurveda, some medicine says it is tumor suppression. Means tumor suppression medicines are there. We give that medicine, it almost in all cases, it affects like adjuvant chemotherapy. See, in adjuvant chemotherapy, many patients I have seen their immunity will go down. So, that itself will be a cause for next cancer, and not to cure this. So if many patients have done that way by avoiding adjuvant chemotherapy, but most of the conventional doctors won't allow for that. But there are some, because they know how it has worked in other patients.
So we had the discussion on the topic integrating Ayurvedic management and surgery in cancer management. I hope this session was informative to the audience. Thank you, Dr. Iqbal.
Thank you.